Many doctors working in hospitals across the GTA are sounding the alarm bells, saying we need to ramp up public health measures before the sixth wave clogs the healthcare system. Now, this is the first time that we've had to navigate a wave without getting regular updates from public health officials. And while the government is taking a different tone from some of those on the front lines, we've been checking in on the local level.
Wear the best quality mask that you have access to, and ensure that it fits well.
That was Toronto's top doctor 2 days ago, taking a much harder stance on masking inside public spaces. Today, Mayor John Tory says he's following Dr. Davila's lead on the potential of bringing back some public health measures.
If the right thing, she says, tomorrow afternoon or 2 days from now is to have some kind of measure to do with masking, but I will follow that advice. But she is the one that has the expertise and the access to all the other scientists, including the ones you see on television, to give me that advice when the time comes.
But a more dire tone is coming from doctors on the ground in hospitals. ER doctor Lisa Solomon-Switzman tweeting, "We cannot ramp up hospital beds. We do not have the staff." And this message coming from the head of the ICU at Michael Garron Hospital.
I don't know how bad this is going to be, but it's happening. And right now, the government is pretending that it isn't happening.
Dr. Michael Warner, posting this video last night, says we need action now to stop this wave from getting out of control.
Shots 3 and 4 need to get into people as quickly as possible. Masks need to go back on in essential areas. If you're going to the grocery store, if you're going to school, if you're going to a pharmacy, which are essential activities, everyone should be maximally protected. You don't know who's immunocompromised, and those people who are vulnerable, have a right to do those things safely. We also need access to early testing so that the early therapeutics that are available can actually be provided to people in a timely manner.
While the medical officers of health in Toronto and Peel Region were not available for interviews today, Dr. Barry Pecos, York Region's top doctor, tells me the GTA is closely communicating.
There's no question that the measures that we have available to us as medical officers of health, including a Section 22, is something we've been thinking about, throughout. I don't think, and many would agree that it hasn't met that threshold yet.
So what is that threshold of public health units taking individual action?
Right. So that's the real question. In terms of where that threshold is otherwise, in terms of, where do we need to act now? How high does that wastewater signal need to go? It's still a bit unsure. And the reason for that is we're seeing lots of spread in the community. We know that. But that's, for the most part, because we have such good, vaccine coverage, it's mostly in people who are not going to get very ill. As medical officers of health, both among ourselves and with the province, we're meeting regularly. We're having conversations about what that threshold needs to be.
Now, when I asked Dr. Pecos about the stay calm tone coming from the province, he said to me, this is still a public emergency, and right now we need to be ramping up third and fourth doses as quickly as possible. There's also some concern about rapid spread over the coming weeks with people gathering for Ramadan and Easter.